Sitting down in a chair, picking an object off the ground, or climbing a flight of stairs are not just gym exercises. These are fundamental human movements that our biology requires for daily survival. But there is a modern contradiction in how we train. While these movements are natural, the exercises we use to strengthen them often trigger sharp knee pain. This leads many to believe that squats are inherently dangerous for the joints or require complex machinery to be performed safely. Exercise-induced knee pain typically isn't a design flaw in the human knee itself. Instead, it signals a flaw in how the nervous system executes the movement pattern. In 2026, the American College of Sports Medicine released an updated consensus on resistance training, synthesizing data from over 30,000 participants to find the most effective way to build muscle. The data was clear. Consistent, simple resistance training drastically outperforms complex, highly optimized gym routines and expensive machines. This creates a central dilemma for the average person. If basic body weight or free weight movements cause immediate joint pain, maintaining the consistency required for these health gains is nearly impossible. Establishing pain-free leg strength relies on mastering two specific biomechanical principles: neurological activation and kinematic alignment. To understand why knees hurt, we look at the lower body's three primary power centers: the glutes, the hamstrings, and the quadriceps. During a squat or a lunge, the nervous system often defaults to the path of least resistance. It takes a neurological shortcut to complete the movement with as little effort as possible. This shortcut causes the smaller quadriceps to take over the workload while the glutes, the most powerful muscles in the body, remain dormant. This creates a dangerous 80-20 quad-to-glute ratio. This severe quad dominance pulls excessively on the patella, or kneecap. The result is intense shearing stress generated across the front of the knee joint. Actively waking up the glutes is the mandatory first step to removing that shearing stress and protecting the joint. When the glutes are inactive, they fail to stabilize the pelvis. As you move downward into a squat or lunge, the hip joint loses its anchor. This lack of stability leads to a biomechanical failure known as knee valgus. This is the inward caving of the knee toward the big toe. This inward angle places intense compressive stress on the inside of the knee joint. Over hundreds of repetitions, this alignment effectively grinds the cartilage. The correction requires spiraling the thigh outward so the knee strictly tracks over the pinky toe. Fixing this alignment instantly shifts the physical load away from the vulnerable knee ligaments and back into the target muscles of the hip and thigh. If a movement still causes discomfort after correcting your activation and alignment, the physical variables of that movement must be mathematically altered. Increasing your step length during a split squat physically reduces the range of motion required at the knee. You can see the difference in these joint angle measurements. This wider step shifts the load away from the knee extensors and onto the posterior chain, specifically the glutes and hamstrings. Direction also changes the load. Forward lunges generate momentum and anterior knee shear upon stopping. Reverse lunges, however, decelerate that momentum and drastically reduce stress on the joint. Even a small change, like elevating the front foot on a 10-centimeter block, alters the knee angle enough to safely bypass common pain points. Understanding the physics of angles and momentum allows you to design a workaround for prior knee injuries while still building significant leg strength. Safely loading the lower body can be achieved through various methods. Alternatives like step-ups, glute bridges, and isometric holds provide a muscle-building stimulus without the joint strain of a traditional squat. Training the legs consistently is linked to broader health outcomes identified in the ACSM data regarding chronic disease. Consistent dynamic resistance training can reduce resting blood pressure by 5 to 7 millimeters mercury. This specific change is associated with a 20 to 30% reduction in the risk of cardiovascular disease. Building leg strength provides the physiological foundation for these improvements, allowing the body to manage blood pressure more effectively through regular activity. Pain-free power is built on mechanical intention, not on pushing blindly through joint discomfort. Symmetrically firing the correct muscles and maintaining strict joint alignment are the primary requirements for maximizing strength gains. Moving with scientific precision ensures a stronger lower body and a resilient foundation for long-term health.